How would you describe the current situation in Wilcannia and the Far West?
It is just an absolute disaster that's unfolding in front of us. And part of the issue is that many of these issues could have been dealt with a long time ago if things had been put in place to prevent the current situation from occurring.
We've heard in the last few days that motorhomes will be operational in the Far West in 3 days' time to help these communities out. How far will that go? Will that assist?
Look, it'll assist a very, very little bit. Motorhomes aren't really appropriate for the situation we're facing. You can imagine people being very, very unwell inside a motorhome trying to get medical assistance. Those motorhomes will be on a caravan park on the outskirts of town. People would be needing to take food out to people who are isolating in these motorhomes, and a number of people will be assisted in that they are not in tents in tents in their backyards or on the riverbank. So motorhomes much better than that, but really it's inadequate for the situation that's occurring.
What is the healthcare situation like in that area? Are local hospitals equipped to cope?
No, they're not equipped to cope. The people working on the ground are fantastic, and this is in no way a criticism of them. But the resources and the facilities that are within those towns struggle to cope on good days. That's without a pandemic. With the growing number of cases that are occurring out there, and as we know that those numbers will grow, they'll get a lot worse, and people will become a lot sicker. People are going to have to be airlifted to places such as Adelaide if the South Australian government will keep taking people from New South Wales, or they'll be having to be airlifted to Sydney. The services on the ground just cannot cope with the magnitude of the problem.
There's been a significant vaccine push in that region over the last few weeks, but recently some Aboriginal leaders have said that there is a level of misinformation about vaccines there. How can authorities get the rest of the community vaccinated if this sentiment is infiltrating the area?
Look, there's a lot of focus being put on vaccination avoidance, where the reality is that is only a very, very small part of the problem. The bigger part of the problem is the vaccines have not been available to people. There are long waiting lists, and that's not just in remote areas such as Wilcannia, it's in the regions such as around Wagga and Dubbo. So to focus on people having misinformation and avoiding having these vaccines is the incorrect focus. The focus is the vaccines just simply haven't been there for people who've been wanting to have them. And there's two reasons for that. One is the number of vaccines available, but the second reason is that the services on the ground have not had the facility or the resources to vaccinate on the scale that this vaccination program needed to happen.
So what more needs to be done then to protect the community?
Well, the vaccinations need to be ramped up. Services need to be put into place that meets the magnitude of this problem. But we also need to, remember that there was time to prepare for this. The services out there last year were writing to the federal and state government asking for assistance to prepare for the virus arriving in those communities, and that assistance wasn't given. So it's a little bit like the horse is bolted and we're trying now to shut the gate. We have to do everything we can to keep as many people safe as we can and to deal with the health crisis that's unfolding in front of us. But we also need to learn from this lesson, and we need to move as soon as possible on increasing the size of the health services in regional areas and ensuring that people have access to adequate housing, which are the two things that really make this crisis the perfect storm.